This is Mohammed.
If you are having back pain and spine surgery is one of the options, you are likely to have thousands of questions in your mind.
We know it's difficult to find reliable information, especially online, so today we'll be answering the most common and interesting questions about spinal surgery. This is Mohammed.
This is Adi.
This is the Neurosurgeons channel.
And this is the only place where you find two neurosurgeons talking to you about everything about the brain and spine. We did our online search on Google, and also we checked the common questions on Quora, and we came up with most common interesting questions, and Adi will start with answering the first question.
So the first question is, what should you know before considering spinal surgery? Well, it's important to know that when talking about having spinal surgery that you seek the opinion of a specialist. Spinal surgery is often performed by both neurosurgeons and orthopedic surgeons. Not all neurosurgeons perform spinal surgery. Similarly, not all orthopedic doctors perform spinal surgery. So it's important that when you get an opinion, it's from a spine specialist. It's important in your consultation to talk to your surgeon about your symptoms and also look and see what investigations you've had so far. Check out our previous videos on the types of investigations or scans that might be done when the investigation of your spine problems, and also we have another video on the potential treatment options for back pain. Also, it's important to discuss the options in treating your back pain. Surgery is just one of them. There are many other treatment options, be it medications, physiotherapy, or needle injections. It's also very important to talk about the benefits of operation versus the risks, and also talk in detail by the expected recovery from your procedure. It's really important that you have all this information together, enable for you to have an informed decision which you make with your spine surgeon.
Another interesting question that we found was asking about laser surgery and would that be helpful to deal with back pain. You are not supposed to understand all of the evidence about spine surgery, but your doctor should be able to explain all of that to you in a simple way that can help you to make an informed decision. There is no large trial or evidence that supports laser treatment for back pain. The best way to get an advice is to speak to a specialist spine surgeon.
The next most common question was, what is the best surgery for my back pain? The answer really depends upon you. Every patient is different, as is their back and the problems that they are having. Some people may have a disc out of place, which is pressing on a nerve. Another person might have spinal stenosis, where the ligaments and joints have overgrown and are compressing a lot of the nerves at the base of the spine. Finally, someone might have back pain due to excessive movement of the bones and ligaments, and they would benefit from spinal fixation. So really the best surgery for you depends upon your problems. If you think of it from a big perspective, the best operation is the one that's least invasive, carries the smallest number of risks, while providing you the best chance of a good outcome.
One last interesting question is, am I going to be paralyzed if I have or don't have surgery if I have back pain or a disc prolapse? As we just explained, not all the patients are the same. And here to specify, we're talking mainly about the low back pain, which is usually caused by problems in the lower back between the fourth and fifth vertebrae in the lower back, or the fifth and the first vertebrae of the tailbone, where most of the patients tend to get disc prolapses in this area. The nerves around this area supplies muscles of the leg and also supplies the bladder and bowel. If you don't have surgery and you have a big disc prolapse that causing more compression on the nerves, the worst case scenario that you can get weakness in parts of the body of your parts of your leg, or losing control of your bladder and bowel. If you have surgery, it carries some risk, with the worst case scenario that the surgery itself can cause injury to the nerves, which again can lead to weakness in parts of the legs or problems with bladder and bowel control. It's very rare to get complete paralysis of both legs from this kind of operations in the lower back. However, this might be true in operations for other areas of the spine, like the thoracic spine or in the neck, where there is more sensitive spinal cord, and this is also rare and it relies on multiple factors, not only just the type of the operation.
Finally, you may have hundreds of other questions that you'd like to know the answers to. The best advice we can give is to find a reliable source of information online or otherwise, and then speak to your spinal specialist to decide what the best treatment plan is for you. In the next video, we're going to talk about common causes of neck pain.